Hi, everyone. Welcome to the Aurora Health Alliance Spring Quarterly Meeting. I'm Mandy Ashley. I'm the Executive Director.
Great. Thanks, Mandy. Welcome, everyone. And I'd like to welcome our two speakers for a Did You Know panel. And we'll get started with Allie Needham with the Colorado Welcome Back program at the Spring Institute. And Allie, welcome. We do have your slides in our presentation, so we're happy to advance those for you. And I'll let you take the floor. Thanks so much.
Awesome. Thank you, Joe. And thank you, Mandy. Or Ashley, right? Mandy. Okay. I'm like trying to keep the names correct. Anyways, thank you guys for inviting me to speak on behalf of Spring Institute and our Colorado Welcome Back program. To give you guys just a background of who Spring Institute is, we are a local nonprofit located in the Denver metro area. All of our programming is community-based, and we do a variety of different services. So Career Pathways is just one of those services that we offer. We also have adult education classes such as ESL, high school equivalency, citizenship. We also have our translation and interpretation network. We have an advocacy branch that has been doing a lot of work at the state level in regards to establishing an IMG residency pipeline, and I can talk a little bit more about that later. We've also done advocacy around ECE and adult education in Colorado. We also have a program called Project Shine, which promotes health literacy and family wellness to our communities in the East Colfax neighborhood mainly. And all of our efforts are focused around supporting people from diverse cultural backgrounds, so a lot of immigrant and refugee individuals. So our mission at Spring is we seek to empower people and organizations to succeed across languages and cultures. And so everything that we do is really driven by that mission. So go ahead and we can go to the next slide. So I am here today to talk about our Colorado Welcome Back program. So Colorado Welcome Back is actually part of a national initiative called the Welcome Back Initiative. And so our facilities amongst several different locations across the states, we work to support internationally trained medical professionals navigate the relicensure process in the United States. And so our program in Colorado, we work with a lot of international medical graduates. That's the most common profession that we serve. But we also support individuals with a background in pharmacy, RNs, LPNs. We also support medical laboratory technicians and then dentists. So those are kind of the main professions that we support, usually the ones with a little bit heftier of a process navigating that relicensure. But right now we're also running a short-term reskilling and upskilling program that's focused on entry-level healthcare pathways. And so those pathways include phlebotomists, pharmacy technicians, dental assistants, EKG and cardiology technicians, and then licensed practical nurses. And so within that program, we're able to offer scholarships to individuals who have an immigrant status, and they could have a background in healthcare, or they could be looking to enter into healthcare for the first time. And so this is a 2-year program that we're offering, and we're just in year 1 of the program. So we can go ahead and move to the next slide. All right, and so I wanted to share just a couple of interesting facts with you all. So the first thing is that CWB, that's our acronym for Colorado Welcome Back, we have served over 1,000 medical professionals from 104 different countries over the past several years since we began in 2010. In the past 3 years alone, we've served 400 active participants. 200, so half of those participants were MD degree holders, and 34 of them matched. Unfortunately, 0 matches have been made in Colorado. Colorado is actually known for not being very friendly towards international medical graduates. And so often the talent pool that we have in Colorado gets sent out to different states. Right now, Illinois is actually one of the biggest states to accept international medical graduates. If anyone follows the Migration Policy Institute, they just did a fabulous webinar discussing the underemployed and unemployed rate across healthcare professions specifically. So right now at Spring Institute, we are working to put an IMG integration bill through our Senate. I believe it's in the Senate right now, but I did link the bill in the slides. I don't know if if the slides will be given out at the end. Yeah, okay.
Yep, we'll
So
send them out.
perfect. All right. So yeah, so the bill language and everything is linked in there, so you can go and look at it, but we're trying to establish a residency pipeline in Colorado. So very interesting work. I'm not super part of it, but if you are interested, you can reach out to me after our meeting today, and I'd be happy to connect you with our advocacy team who's doing such a great job with that. And then lastly, 48% of immigrants hold a post-secondary degree, but 2.4 million of those are underemployed or unemployed. And I learned this morning with the MPI webinar that I attended that 270,000 are healthcare workers. So very, very interesting statistics, but I think it really speaks to we're underutilizing the talent that exists across our nation. And so our mission within Colorado Welcome Back is to really tap into that talent pool and get international healthcare workers employed and living out their profession in the United States and giving back to our communities in that way. So I will open it up to questions. Yeah.
Thanks, Allie. There was one question that came through, and that was, what are the main countries where the international medical graduates are trained?
Yeah, great question. It really does depend on the year and where people are coming from. Right now, as you could probably know, we are working with a lot of the Afghani arrivals that arrived earlier in 2021. And so, yeah, that's kind of what my main focus is on, is helping those individuals right now. But we have people from all over the place. Yeah, and some individuals that like grew up in a certain country but did their healthcare training in like European countries, things like that. So we work with people from all over.
Allie, this is Rich McLean. Allie used the term match. What does that mean?
Yeah, so for medical doctorate or medical doctors and degree holders, they must go through the same matching process as US trained doctors have to go through. So if you're familiar with the medical education kind of system and how medical doctors kind of go through their residency, in order to get into residency, they have to match with a residency program. And so international medical graduates have to go through that same process. And it's even more competitive and more difficult to get into than if you did your training in the United States. Mm-hmm.
Oh, got it. Thank you.
Yeah.
And,
Yep.
and then the second question, is there significant resistance to that bill to open up international trained people to come into our medical system? Do you know?
So far, we've had really, really strong support from both sides of the aisle on that bill. So it's looking very hopeful that it will be passed this season, but then we'll have to go through and create those pipelines and those systems and everything to make it actually happen. As far as introducing internationally trained medical graduates into Colorado, I'm not sure where that resistance is or exactly how it's positioned. But for some reason, Colorado just kind of is not very welcoming to international medical graduates and getting them into residency programs.
All right, thank you.
Yeah, thank you.
Thanks, Allie. There's one more question and then we'll move on to our next speaker. Is language barrier a significant challenge for placement?
Yeah, great question. So my background is actually in adult education and teaching English as a second language. And so I love when this kind of subject matter comes up. So for the participants within Colorado Welcome Back, they do need to be at a very advanced language level, like college ready, because they have to take the same medical exams as a US trained physician would have to take. And so their language has to be top notch. But if they're not quite there yet, we are always referring our individuals to other English language programs, whether that's through Spring Institute or another language program. We are very well connected with adult ed programs across the state. And so we're always taking that into consideration. And when someone does join our program, if their language is questionable and I'm not quite sure if they're at the level where they need to be, I am able to give them a standardized language assessment to determine their language level and see if they actually are ready to move forward with that post-secondary kind of training and assessment.
Great. Thank you so much. I really appreciate it and the work you do. So next we'll move on to our next speaker. I think we've got your slides pulled up, Ramsey. Yep, great. All right, Ramsey Ferguson, Housing Connector. Go ahead. Thank you so much.
Yeah, thank you, Joe, and hi to everyone. Allie, thanks for sharing about your organization. That was great to hear about. I am Ramsey Ferguson. My pronouns are she, her, hers. I am the Community Partnerships Manager for Housing Connector, which is a new nonprofit in the Metro Denver area. We are a business-to-business nonprofit organization who are partnering with properties and service providers to reduce barriers to housing and increase our community's housing capacity. So our vision is that we believe that no unit should sit vacant while there are households in need of homes. And so that's where we step in to partner with property partners and community service providers to bridge the gap between those two groups to expand this capacity. So we do that in a way by offering property partners a financial incentive customer support package in exchange for pre-negotiated and reduced screening criteria. So service providers who are partnered with would have access to units with that pre-negotiated or reduced screening criteria in order for people to access homes in a more expedited manner. So we're seeing win-win solutions through our model, which is property partners are having their bottom lines protected through this customer support or financial package. And then our community partners are supported with expedited housing search processes and access to units with reduced screening criteria for the clients that they are serving who may either be experiencing homelessness or housing instability. If you want to pop over to the next slide, Joe. Thanks. So did you know we partner with property partners to reduce screening criteria in the following 6 categories. So each conversation that we're having with property partners is individual and it varies from each group that we're partnering with. But we are working with properties to see how low they will go in the following 6 categories to lower some of those barriers for folks during the application screening process when they are trying to move into housing, whether it's through a voucher, a rental assistance subsidy, or the means to be able to afford rent on their own. So we're working to waive the requirement for credit score and rental history, lowering the income to rent ratio requirement, working with properties to be flexible around rental debt or rental arrears, evictions, so those different blemishes that might pop up on folks' histories, and then criminal history as well. So seeing how flexible or how low properties could reduce their screening to be flexible around some criminal history components. We are partnered. So did you know that we are partnered with Zillow to provide streamlined access to all these units? So how it all comes together is on the Zillow platform. Service providers, case managers, housing navigators can get on Zillow and see all of the units that we are partnered with the reduced screening criteria attached to it. So it's all very upfront. It's really accessible so that folks are not wasting time or money applying to units that they might not necessarily qualify for or that might not have the lowered barriers that they need. And if you want to go to the next slide. We started, so did you know Housing Connector first started in King County, Washington in July of 2019. So as I mentioned, we are new to Denver. We've been operating our model in the Washington area, in the King County, Washington area since July of 2019. So a little over 2.5 years. We expanded into Pierce County in the Washington area, which is Tacoma, so just right in that same region, and then launched in Denver in November of 2021. Since we've launched in July of 2019, we've helped house over 2,700 individuals. We've partnered with 1,000 plus properties, which accounts for 56,000 plus units. And we are currently partnered with 140 plus community partners. Of the 2,700 individuals that we've helped house, 66% of those individuals identify as BIPOC. And we're seeing a 96% retention rate in individuals who are graduating from our program, which is 2 years. So folks are staying in the units that they moved into after that 2-year graduation. And I think it's largely due to good relationships with their landlord and in the community that they're living. One last piece here before I open it up to questions that I forgot to put in the slides is we are not just in the business of housing folks and expediting that process, but we also want to make sure that folks are staying stably housed. And so there is a housing stability component to the model that we're operating in that we provide housing stability support for the property partners and our community partners to make sure that we're addressing tenancy issues that arise, to make sure that any smaller issues don't turn into larger issues and end up getting folks needing to exit their tenancies for whatever reason. So just that additional plug there. So I will open it up for questions that anyone might have, and we'll certainly share my contact information as well if anyone wants to dive a little bit further. Yeah, it looks like Erin, you want to?
Go ahead, Erin.
Hi, I'm Erin. I'm a family resource navigator with Arapahoe County Human Services. And I think I actually heard maybe your predecessor or someone from Washington State speak about you guys starting last year. And so I'm glad you guys are here. Thank you. It sounds like you do something similar to what Aurora Housing has and Kathy Blair, if anybody knows her, as kind of like a landlord recruiter in a way. It sounds like, and when I had reached out to whomever, I guess is out of Washington, who was kind of helping build this here, she said she had a connection with Arapahoe County already, but nobody's been able to figure that out. So I'm hoping that I can get your contact information, or maybe you already know, you can share, but when you say stable housing support, is that through the agencies you're connecting property managers with, or you guys as an organization do that as well?
Yeah, so that's a great question. Thanks, Erin. So when we partner with community partners, or we call them community partners, but the service providers, we are asking that those service providers offer a year of housing stability support for the first year of that 2-year enrollment that households have with us. And then in the second year, if they're unable to continue to provide that housing stability support, then we are able to step in as Housing Connector and provide that support for the second year. In Washington, we've contracted out with an outside agency to do that. We haven't quite locked in what that will look like here in Denver yet, but those would be the 2 options for that.
Okay, thank you so much. This is amazing. Appreciate
Yeah, you're
you.
welcome. Thanks for your question.
Thanks, Ramsey. We did have a couple questions in the chat.
Okay.
One of them was, has your criteria changed or been affected by the pandemic?
In terms of like the reduction, I'm not sure who asked that question.
I think in the previous slide, there was the criteria for housing around, evictions and things like that. Has that changed at all or been affected?
Oh, in response to the pandemic, yeah. So as I mentioned before, we go into those conversations with somewhat of a baseline, but it's really going to vary from property to property in terms of like how low each property or how flexible each property is willing to be. So what I've seen recently as kind of a catch-all is like properties being willing to work with folks who have 2 or 3 evictions on their record in the past 3 years. So I do think that would align to maybe, with things that we're probably seeing as a result from the recent pandemic. So.
Great. And there's a question in the chat from Julie Jones. It says, if I am a case manager doing a Zillow search, how do I know which property is Housing Connector? Does your logo or name appear?
Yeah, great question. So when you are a partner of ours, community service providers, when they partner with us, they sign a memorandum of understanding. And once that's locked in for partnership, that agency is then able to receive an exclusive login for Zillow, which will allow them to filter for our units. So when you go in and filter for things like accepts pets and whatever else, you filter for accepts Housing Connector, and then all of our units will pop up. And then within those units is where you will see that specific property's criteria, like where they've reduced it to. So it's all right up front on the platform. Good question, thanks.
One question came in earlier. How can this group help the Housing Connector effort?
Yeah, thank you. That's a great question. Yeah, so I think we're just trying to spread the word. When we moved into the Denver market, we launched in all 7 counties, which we learned some lessons from. So we had to take some steps back to see how we can target the market specifically around properties. I don't want to paint a rosy picture. When folks are running into walls with housing, it's because it's there. And it's a really hard market, not just here in Denver, but in a lot of our metro communities. So I think we're seeing that as well. And so things are moving just a bit slower than we had anticipated in terms of bringing on property partners. So I think in terms of support, if you want to spread the word to community service providers that we're here, we would love that. If you know of any property owners that might be a good fit for what we're doing, large or small, we would definitely welcome those referrals as well. So I think those are the 2 key areas that would be the most helpful for us.
Great. And I'm sorry, Julie, I missed your follow-up question. So I'll ask this one last question to follow up around the Zillow search. So is it a paid partnership was the question?
Oh, no. Yeah. So our services are free of charge to both our property partners and our community partners. I know this will probably be the next question, so I'll go ahead and answer it. Is how are we funded? In the Washington market, we've been funded primarily through local and city grants, so really connecting in those platforms for grant funding. And then here in Denver, we are currently 100% privately funded. Just enough folks are behind our mission and what we're doing helped us move into this market, and so we will be going after looking to seek those opportunities for grant funding in this community as well. So
thank you so much.
Yeah, thank you. Thanks for all the great questions.
Yeah. Thanks for your time and good luck with everything. I know I didn't realize how new you were to the Denver area.
We're so
that's
very
exciting.
New.
Yeah.
So very new.
Yeah.
But yeah, folks, feel free to email me separately if you have any other additional questions. And thanks for having me here today.
Great. And if it's okay with you, we'll again share your slides with the group after the meeting. Great. Thank you.
Thank you all for joining.
And thank you, Allie and Ramsey, for your presentations.
Yep.
Thank you. Have a great weekend.
Thanks, everybody.